This is Wellness Through Physical Therapy, pandemic style. I'm Julia Wiegand. We'll be social distancing today, meaning I'll still be here just off camera so that we can have Tingo front and center in a few to talk hip pain. So I'm heading in right now, but don't go away. When we come back, we'll have more on hip pain with Tingo on today's episode of Wellness Through Physical Therapy. And welcome back, everyone, to Wellness Through Physical Therapy. I'm Julia Wiegand, sitting at least 6 feet away from the one and only Tingo. How's the weather over there, Ting?
Very nice. I think it's 72 degrees in here.
Yeah, it's very cool.
Yeah.
And it's also good to see you. You are going to be talking hip pain with us.
Yes, I am.
Now, there are multiple different causes of hip pain.
Right.
I guess we can just start off with the basics. What are some of those causes?
Right. So the most common cause of hip pain, obviously, is from the hip itself. So the hip can create pain if it's got arthritis, if it's got tendonitis, which happens in some of the muscles, especially on the outside of the hip. And there's a thought that bursitis can cause hip pain, but diagnostically, when we look at it, it's actually quite rare. And the other areas that potentially could cause hip pain is coming from the back. Typically, that'll create hip pain more in the back of the hip, and also like the knee can create hip pain, and muscles, including in the front of the hip, can create hip pain as well. So there's multiple structures, including joints, muscles, fascia, back, knee, so multiple causes.
And it sounds like it's super important for you guys to kind of get to the bottom of where the source of that pain is coming from. The hip, it's not just the hip, it's the back, like you said as well.
Right. Yeah, it's extremely important because obviously, if we get the source of the pain wrong, it's very hard to fix that problem. So for example, recently we treated a gentleman who came in with what was diagnosed as back pain and sciatica. After treating him for a while, his back felt better, but his hip pain in the back of the hip never got better. So we're luckily that we have some diagnostic tools here, so we were able to look at his hip with an ultrasound imaging. And we found some muscle tendinopathies and muscle tears in the glute muscles, which connect right at the back here. And once we realized that and started treating that, he was able to get better relatively quickly to the point where he's able to sleep through the night now when he wasn't before. And he can walk a lot more comfortable through the day. So really understanding where the pain is coming from and being able to identify it can go a long way at helping people fix the problem.
And you guys definitely go out of your way to help everyone that walks into Fyzical.
We try, yes. That's our ultimate goal, obviously, is to help people feel better, because the more people we help feel better, the more they tell people about us.
Well, when we come back after the break, we are going to be talking with Ting a little more about what you can exactly do to alleviate hip pain, find the source, and make sure that you get a great night's sleep. We'll be right back. Welcome back to Wellness Through Physical Therapy. I'm Julia Wiegand, and again, I am sitting 6 feet away from the one and only Tingo, who is here today to talk with us a little bit about hip pain. Now, Ting, you've said already that there is more to hip pain than just the hip. There is a source, and that source is extremely important to find in order to treat. So how do you guys go about finding the source?
So yeah, obviously depending on what we think the hip pain is coming from, we want to try and sort of either confirm or deny that. So classically, the rule of thumb is if it's happening somewhere in the front of your hip, classically it's either coming from some of the muscles in the front or the joint itself. If it's coming from the outside of the hip, the classical thought is it's either bursitis or tendonitis. If it's coming from the back of the hip, you typically start thinking, is it coming from the back or is it coming from some of the muscles in that area? So based off how someone presents to us, we would want to think about trying to look at the tissues in the hip structures itself to see what we can find. So one of the best ways when it comes to soft tissue like tendinitises or bursitis is we have a machine here that allows us to image structures through ultrasound like you would if you were pregnant and you were looking for babies. Right. But instead of looking for babies, we look for like muscle tightnesses, tendinitises, and bursitis. So like for example, if we have a look at the common muscles that create lateral outside hip pain are the two gluteus muscles. One of them is called the gluteus medius, the other one's called the gluteus minimus. And a lot of experts now believe that that is the source of a lot of people's outer hip pain. So through ultrasound imaging, what we can do is look at those muscles and be able to identify if they're torn, if they're swollen, if they're tendinotic, and the severity of it. So obviously if someone's getting outer hip pain, and it could be potentially coming from the back as well, we can sort of get in there and confirm whether it's coming from the hip or coming from the back. Same thing with posterior back of the hip. So like I referenced earlier, that patient of ours, once we identified, we initially treated him with a diagnosis of low back pain causing sciatica. So, but when it wasn't getting better, we were able to identify and have a look at the hip through imaging to be able to tell, yes, he actually had a torn tendon in his muscle, the gluteus minimus and medius muscle. So once we focused our treatment there, obviously things changed and he got better. The other diagnostic test that we do here at Fyzical is EMG/nerve conduction studies. And what that does is it assesses the nerve conduction or the nerves coming out of your back that could be creating problems down the leg. So what we do with the EMG is we can tell whether the back is causing the pain down your leg. So for example, if this gentleman with the back pain, we found nothing wrong in ultrasound imaging, the next step potentially would have been to do an EMG on there to see if, yes, if it is the L5, I don't know if people know what L5 is, but coming from particular parts of your back, if it is the L5, if it is the L4. And the cool thing about EMGs is some of the newer technologies out there, the new advancements, it allows us to be able to detect when a nerve is actually being pinched and what functional positions are pinching that nerve. So for example, again, we've had some people here where we've been able to identify their nerves are being pinched when they're bent over or when they're leaning to the side. And this way, if it is the case, obviously we would want to stop exercising into those directions to stop the nerve from being pinched. And we're able to develop a plan that minimizes the pinching, which obviously can long-term help with the pains that shoot down the leg. So,
and what are some of the things that people do or accidentally do that get them to that point? Mm-hmm. I know a lot of people, when they work, they do a lot of heavy lifting, but even so much as a youth sports athlete.
Right. So yeah, so there's a lot of things that can create hip pain, and so through life we get hip pain. But what I've found, one of the biggest issues that people have that create hip pain is muscle weakness around the hip itself. So there's a big muscle in the side of the hip and the back of the hip called the gluteus medius and maximus. So and athletes especially, a lot of the newer research out there shows that athletes, the power in athletic function comes from the hips. And runners, golfers, all that stuff. So people that have weaknesses around the hips, and it's not a muscle or an area that a lot of people work on. A lot of us like to work on the quads and the hamstrings. Not a lot of us like to work on the hips. But different exercises, I'm sure we'll reference that in another segment. And another thing that they found is stability of the lower extremities as well. So when you have problems with your feet, I'm sure we've talked about pronation before on this show, and when you have problems with your feet, it causes problems up the chain and causes your hip to be twisted which again, over long term can create problems as well.
Right.
So, and like you said, workers, people that constantly use and abuse their body, and if you're anything like me, I tend not to pay much attention to little things until they become big problems.
Right.
So yeah, one of the sayings I have is look after small problems before they become big problems. So just through life, arthritis, a lot of people develop problems, but our message is always, get it checked out, especially if it lasts longer than a couple of weeks. Get it checked out. This way it doesn't have to become a major problem further in life.
Well, when we come back after the break, we will wrap up our segment on hip pain, and we'll talk about how to stabilize and how to strengthen your hips so you don't get to that point.
Right, cool.
We'll be right back on Wellness Through Physical Therapy. And welcome back to our final segment on today's Wellness Through Physical Therapy. I'm Julia Wiegand, and although I'm standing 6 feet away from the one and only Tingo, we have Travis over there featuring as today's model to explain how Fyzical figures out how to alleviate hip pain, finding the source. We discussed what causes it, where it could be caused from, and why it's so important to find that source. Now, earlier, just before, you were doing an ultrasound on Travis.
Yes, yep.
So explain kind of how that works really quick.
Okay, so what we do is we look at the areas where the tendon connects to the bone, and when we do that, we're able to identify the quality of the tissues. So the bright colored areas are good quality tissue, and for someone Travis's age, 30, right, Travis? Yep. You should have nice, smooth, bright colored bone at the very bottom there. So you can see with Travis, there's a couple little like indents in there. So Travis said he's had some hip issues on the other side, so potentially, he may potentially have a little bit of degeneration from years of sports, right, Travis? So on the left hip as well. So being able to identify that is great because then we can tell that there is an issue there and we can focus some of our treatments in that area.
And step 2, right now we have the wave.
The miracle wave. So yeah, one of the things that can be very good for tendinopathies to break down scar tissue and help healing process is what we call a radial shock wave or an acoustic shock wave. And what that does is it gets into the tissues kind of like a deep shock wave, and it's like a pressure wave, and it shocks the tissues into breaking down and regenerating and regrowing again. Really, really good for tendinopathies. So this machine has a little sound head here, has a piston in there that helps kind of like gets into the tissues. I'll turn it on. Gets a little noisy, but what it does is it kind of feels like a tapping sensation, and we can adjust the pressures depending on the person's tolerance. So we got it at 1.2. We can get up to about 3 or 4 bars of pressure, which causes really deep stimulus. This being a fairly shallow area, it's not so bad. Okay, so it's a great way to start off therapy because what that does is it helps us get started in terms of our treatment and helps prepare the tissue to warm it up, get the blood flowing, and also helps the scar tissue to kind of break down and remodel so that when we get into the stretches and strengthening aspects of it, the tissues are ready.
Now, are we going to have Travis demonstrate some strengthening and some stretches for us?
What do you think, Travis? You up for it?
Yeah, let's do it.
All right. So let me pop this guy away. Let's clean Travis up here a little bit. And I'll pull this up so we don't get to see Travis's butt. Not that some people might not want to. So you good there, Travis?
I'm good.
Okay, so one of the areas that gets really tight with hip problems is the butt cheek or the muscle that we call piriformis, right, Travis?
Yes.
So a great way to try and loosen that up is either with our hands, but if you're at home wanting to do something yourself, there's these things called foam rollers. And a great way to loosen the piriformis. Could you show them how to loosen the piriformis, Travis? So what you want to do is you want to sit on the foam roller itself on the side that's irritated and cross your leg over the other one. So all the pressure is on that hip itself. And then once you get that, you move around until you feel that tight spot. Once you feel that tight spot, just roll forwards and backwards, side to side, like Travis is doing for a couple of minutes. That can be a great way to loosen up tightnesses in the piriformis. Feels good, right, Travis?
Yeah.
All right.
Right there.
Cool. So, and the other important one is the IT band. Most people have heard of the IT band. The IT band also connects to the hip and also the knee. Big issue for runners and athletes, and also for seniors as well. So you want to show them how the piriformis is done, Travis? Not the piriformis, but the IT band. So what you want to do this time, you want to roll to the side like that. And just move that foam roll into the middle of the thigh. Can anywhere between the knee and the hip itself. So get to the point, again, where you feel it. And typically with the IT band, it's in the mid band. So typically about here. And you want to roll forwards and backwards, side to side, until you feel that spot. Once you get that spot, like get on that spot and just roll forwards and backwards a little bit, because that'll be great at loosening up the fascia. And when you loosen the fascia, it also loosens the muscles and the tendons. So, feel good, Travis?
A little more tender, but it's working.
Yes. So you want to spend like a couple of minutes on each spot. So the time frame that we talk about in therapy is 90 to 120 seconds. So think about 2 or 3 minutes on a spot, and it can go a long way helping reduce tightness and pain.
And it might be a little easier if you're wearing, shorts or comfy clothes.
Yes.
I know he's dressed ready for work, so.
Yes, and obviously skin contact is important when you're talking fascia, but for the sake of demonstrations, Travis has nice, are they purple pants today? And,
Blue maroon.
Blue maroon, okay.
Stretch a little.
Beautiful, beautiful purple pants there. All right, that's good, Travis. Good job. So two key areas to loosen up in terms of like foam rolling. And, but if you're finding it difficult to get into those areas, that's obviously where us health professionals come in, because we have the tools like the scrapers and the cupping and all that stuff that we can get into those areas and really, really try and loosen them up for you. And always do that before you exercise, because when you're not ready to exercise and you're not warm, you're definitely at risk of injuring yourself.
So we've got the foam roller kind of working out what's going on.
Right.
But before anything, no matter what, stretching. Stretching
Yes.
is huge. Stretching is very important. What are
Right.
some of the stretches that people can do to either alleviate or avoid hip pain?
Yeah. So the key stretches in the hip are the key important hip muscle to stretch is the hip flexor, because a lot of people have tightness in the hip flexor, and as we go through life sitting most of the day, we tend to get those hip flexors locked down. So a good way to stretch the hip flexor, if I could get you to maybe on your knees on here, Travis. I don't know if it'll fit in the camera, but we'll see if we can show it. Yep, so a good way to stretch the hip flexor is just like this. So what you want to do is have a knee comfortably on the ground into what we call a half kneeling position. In this position, you want to posteriorly tilt your pelvis a little bit so we don't get the back on stretch. And from here, you want to lean your body weight forward, trying to keep your hip neutral. And what that will do is really get a stretch in the front of the hip there. So a lot of us in the Western world don't tend to be upright, leaning backwards a lot. So when we sit a lot, this can be a really, really good stretch for people. And the other important stretch in the hip is the piriformis muscle, like we mentioned previously. So roll on your back, Travis. Let's show the piriformis stretch. I'm glad you're flexible. And, so the piriformis stretch, just bend this knee up. So this is the easiest way. So we're stretching this side. And what Travis is doing is just crossing his ankle on his knee and just grabbing onto this knee here. And we'll do it the easy way. And just pull this towards the opposite shoulder. Okay, in that position, what you're going to do is get a nice stretch in the butt region. And with stretches, remember, you don't have to push hard. You only want about a 2 or 3 out of 10 in terms of intensity of a stretch. And you want to hold it for up to about 30 seconds to a minute to get a good stretch. If you're going over a minute, you're not really going to get too much more benefit out of it. And 15 seconds is great, but if you can sustain a stretch for 30 seconds, sometimes that's even better. So stretching is extremely good. Make sure you stretch.
Most definitely. And those are some of the most important ones to keep in mind.
Yes.
Now, what does somebody do, like you said earlier, you touched on it, when they come to, when they come to you guys, when should they really consider, hey, maybe this is a little more than just a little push here, a little stretch there?
So what you want to look out for at home is if you have a pain anywhere And like simple things like putting heat on there, doing some light stretches, doing some like cardio, doing some gentle like foam rolling, and the pain doesn't go away. If it doesn't go away, it's probably more than just like a muscle soreness or a workout soreness. In those respects, seek the help of someone, because if you ignore a little problem like Travis, let's say he has some hip tightness, and it's not something, he knows how to look after it, fortunately, but if he didn't, like Travis is 30 now, by the time he gets to 45, my age, or 48, that problem could be magnified to the point where something is now damaged. And if it's damaged and it's irreplaceable, irreparable, then he's obviously left with a problem that he could have had resolved when he was 30.
Right.
So for someone out there at home that are doing these things, be sure not to persist if the pain that you're doing it for doesn't get better. So if you're doing it and it's not getting better or it's getting worse, don't think no pain, no gain applies, because it doesn't. And the last thing I want to do is like get people out there, especially trying to do some things that I showed them to do, and make it worse. So if, for the people at home, if you are having hip problems and you're not getting it resolved by doing some simple things, maybe it's time to get it checked out by a physician or physical therapist. I'm biased, so physical therapists are good at checking things out, and with some of the diagnostic tools that we have, obviously we can like really hone in on what exactly is going on, and once we hone in, we can make the treatments a lot more successful.
And rumor has it, for the viewers out there, you guys have a special.
Yes. So August 29 at 11 o'clock. Thanks for that, Ryan. August 29, 11 o'clock, it's a Saturday. We're going to be doing a workshop on hip pain. So it's designed for people with hip troubles that might want to know more about what could be causing their pain and what potentially they can do to try and help it. So some of the things we're going to talk about is the top causes of hip pain. We'll get into more detail in it. We'll also talk about how you can go about identifying what is causing your hip pain. And based off those diagnoses, we can start talking about treatment options that may be available out there. And the workshop typically is very interactive. We like to talk to people, so we're also always open for questions. So if someone wants a particular question answered, come into the workshop and ask questions, because our goal is to try and educate the people as much as possible, because I feel the more people know about their problems, the more likely they are going to get it resolved. So come on in, give us a call. Be sure to register because of the COVID virus going on. Seating is going to be limited. We're going to be following all CDC guidelines, including wearing masks. Seats will be separated by 6 feet, and we're going to follow all precautions. So if you're interested in coming, give us a call. This way you don't miss out on a seat.
Sounds easy enough.
Yep.
Well, thank you, Tingo, for squeezing us in today. That's all the time we have for today, but be sure to mark your calendars for August 29th at 11 o'clock, a big workshop that Fyzical has going on to talk hip pain. But that's all the time we have for today's episode of Wellness Through Physical Therapy. I'm Julia Wiegand, and we will see you next time.